Hi guys, I'm Dr. Kate Henry here today with Dr. Asare Christian to talk to you about migraines. Dr. Christian, thank you so much for being with us today.
Yeah, thank you so much for having me here. I am super excited and I look forward to this discussion and how we can educate our patients, get them better. Yes.
Me too. You have a really cool practice, and I was hoping you could tell everybody a little bit about yourself, your practice, and your unique approach before we get started.
Yes, thank you so much for that question. As Katie said, my name is Dr. Christian. I'm a physical medicine and rehabilitation trained physician, and I just opened a practice in Wayne called Aether Medicine. And Aether Medicine focuses on what your pain prevents you from doing, easing unnecessary suffering, unnecessary medications, unnecessary surgeries, while making you the healthiest person possible. And that's the whole paradigm of what we use to treat individuals, because sometimes individuals have pain and they come in and they just want to focus on the pain. But the idea is once we make you healthy, all the other interventions works better. So the emphasis here is let's make you healthy first and the pain will get better. And we focus on using complementary approaches as well as pharmacological approaches to help individuals get better.
My gosh, snaps for that. Yes.
All right, thank you.
And guys, you can see why we align, right? Because naturopathic medicine is focused on emphasizing the health of a person so that they can heal themselves, right? When your biochemistry is right, you're more likely to heal any symptoms you've got. And human biochemistry is just run using nutrients. So we are very
Absolutely.
yes. So I'm thrilled for you to be here because I think, and guys, I'm thrilled for you to hear from Dr. Christian because there's actually a lot of updates in how we treat migraines over the last few years that many of you may not have heard about. And so, Dr. Christian, can you tell us some of the new interventions that you're using with your clients and having success with?
Yeah, so that's it's exciting also to kind of talk about new ways to treat migraines because how we've treated migraines in the past has been really medicines that were not designed specifically for migraines. So we were using hypertensive medicines, anti-seizure medicines, antidepressants, and we can even go into a little bit of this, but all of these medicines were not specific for migraines. They had a lot of side effects, and even the medicines that we use for treating acute migraines, triptans, if you have migraine, if you've probably tried some of those medicines tend to cause vasoconstrictions of your vessels. So if individuals have any type of cardiovascular disease, they couldn't use it. But now we have a different molecule which is involved in the migraine pathophysiology called CGRPs, calcitonin gene-related peptide. So there's something we can talk a little bit about. But we have different molecules that can actually target those specific molecules, and that has been a game changer for individuals with migraine. But we know that's not all the story. There's so much to migraine than just taking a pill. So we are very interested in kind of educating individuals about the holistic approach to how we actually help patients. But there's a lot of options now. We have the medicines, we have some devices that are on the market, and we also have some injections and other things. So I think when it comes to migraine, we have a lot more options than we've previously had.
I love it. And guys, if this is news to you, right, it's worth an updated visit either with your neurologist or if you're local or even anywhere all over the world, you can see Dr. Christian to learn about these new options for you. So Dr. Christian, you mentioned some devices, injections, and medications. Can you talk us through like some specifics in terms of what you mean?
Absolutely. So in terms of medications, the new medicines that are out there. So previously we're using triptans. There are 7 of them. They do have some side effects. This is for the acute treatment of migraines. And then we have NSAIDs or anti-inflammatory medicines. All of them have limitations, side effects. They actually can even increase the headache. So they can turn your episodic headache into chronic migraine or because of rebound headaches. But in terms of the new medicine, this is based on, as I said, CGRP. And CGRP is this neuropeptide or a molecule in our physiology that actually binds to vessels in the brain and cause dilatation and then causes also inflammation, neuroinflammation. So this is kind of the cascade that leads to migraine. And what we have been able to figure out is that when we have a way to block CGRP, that actually decrease migraine. So we have CGRP and then we have a CGRP receptor. So the mechanism for how we try to block this activation of the neuroinflammation leading to the migraine is either attacking the CGRP itself or blocking the receptor. So we have created medicines to either attack the receptor site or blocks the CGRP molecule itself. So I think I'm all over the place, but I'm trying to kind of explain in a way that makes sense. So in terms of medicines that blocks the receptor, we have something called calcitonin gene receptor antagonists. So those medicines, and I'll use the generic name so individuals can be familiar with them. So we have two. These are for acute migraine. So we have something called Nortec and something called Ubrivi, and this is for acute migraine. And this medicine basically just attack the receptor site and blocks that inflammation from taking place. And then outside of that, we also have a different class in that same medicine chemistry, which is more of a monoclonal antibody. So with the other medicines, the receptor antagonists, the issue is that sometimes they don't work right away, and then sometimes they also can cause some constipation, some other issues that we have with some of those medicines and side effects. So they've come up with a new monoclonal antibody, which actually will either also, again, bind to the neuropeptide or bind to the receptor side. And we have 4 of those medicines, and I will just briefly mention them. We have Aimovig, we have Emgality, we have another one, Jovi, and then there's a new one called Vyepti, which is actually an infusion that individuals can get, and that may give them relief for 3 months. So those are kind of the new medicines that we've had, but we've also had botulinum toxin or Botox for migraine. So that's also an option that people can explore. That's for preventative medications. And then going on to the devices. So that's something you wanted to talk about? Or
yes, absolutely.
Yeah. So outside of those medicines that helps, we also have neuromodulation devices that actually changes the perception of pain or how pain is being processed. So there is, I think we have 5 that are FDA clearance, meaning they've been considered to be very safe to be used. And this actually have great outcomes and great options for patients. So there's one called Cephali, and this is something that individuals will put, across the head. And this has activation, or it works on the trigeminal system. So we know migraine has this trigeminal system. There's neuroinflammation, there's gut-brain connection. There's all of these things that plays into migraine. So that's a device that helps with kind of acute as well as chronic migraine. So individuals may turn it on for an hour or so to kind of try to bring things down. There's also another device called Gamma Core. And Gamma Core is a device that actually activates the vagal nerve, right? The vagus nerve. So we know the vagus nerve kind of goes all the way to the brain and to the gut, and we know there's a huge brain-gut connection with migraine, as I mentioned. And this is one that actually helps a lot for different type of migraine. So we have all this other type of migraine, hemicranial migraine, cluster headaches, and all of those do respond specifically to this Gamma Core without significant side effect. And then we also have a device called Relivian. And Relivian is also one that actually it has the same approach, kind of close to the Cephali, where there is a placement within the occipital region, in the frontal region. And then there's also a part of it that activates the occipital region. So there's occipital stimulation as well as the trigeminal system. And this actually works a lot better because in contrast to the Cephali, which is a little bit uncomfortable, it's a little stiff, the Relivian is very light, and individuals can use that very simply. And then there's a 4th one. Actually, there's 5. So the 4th one is one that individuals actually, it's like a little patch that people will put on their arms, and they can use their own little cell phones to kind of manage all of that. So all of these other options outside of the pharmacological interventions. The issue is that a lot of this device is access. It's not covered by insurance, and individuals have to pay out of pocket. But that is a lot of options out there, even for pediatrics who can use medicines, and even some of them, one of them called Neurostim, that's actually approved in Europe, and that one actually has been shown or has been approved with pregnant women. So this is an option that if you're pregnant and you have migraine and you can't take medicines, that's an option for you. So that's a little bit of a kind of spectrum of options we have up there. But beyond all of that, one of the things that I talk about is this idea of even going back to this whole calcitonin gene related peptide. So this CGRP becomes activated with nauseous stimuli. Okay, so this is something I want the audience to really get, and I'm going to explain it for you. So, okay, CGRP get activated with nauseous stimuli. So what is nauseous stimuli? So what I'm trying to get to is, like, even though we have these great medicines, sometimes individuals say, I got the medicine, it works for me, everything is great. And then eventually the medicine doesn't work anymore. So the emphasis here is really trying to going back to the root, which you've talked about, really making people healthy. Is a nauseous stimuli is anything that your body or your physiology perceive as painful, stressful. So it could be not drinking enough water, having a bad sleep, having inflammation, having stress, having a bad day at work. All of those are nauseous stimuli. So really, to get to the root of how we actually prevent migraine and make you healthy is really trying to figure out how do we avoid all of those nauseous stimuli or triggers. And this is why I think, your expertise will really help us more to educate people about some of the things that we need to do to really get us healthy, to kind of prevent this thing from starting in the first place. And more importantly, the approach is that pharmacological treatment should complement, not replace non-pharmacological management. Okay, so the idea is that we have to get people to do the healthy stuff first.
You can do it all, guys. And
Yes.
That's the beautiful thing, is that you don't have to choose one option. You don't have to choose devices or like pharmaceuticals or nutrients. You get to do it all. And it depends on what brings you relief. If you're happy with your pharmaceutical and that works, great, go on, live your life. But what Dr. Christian is educating us about is, if we don't fix the root, then we're likely to run into other problems down the road. And so I love that you have this approach, and your patients are so lucky because you're talking about the full spectrum, which is really important. So I think in my practice, guys, I'm really lucky because I get people who come in, they've got a program that sort of works for them, but they need a little more help, or they want to know, how do I use food and what I do in the kitchen and in the gym, the 364 days a year I'm not in the doctor's office, to reduce my migraines, right? And like, that's your right to know that. So there's a couple things. I think, as Dr. Christian said, sleep is a really big trigger for migraines. If you have a sleep disorder or sleep deprivation, it makes it very difficult to control neuroinflammation and oxidative stress, which are part of what's at the root of many people's migraines. And so there's a number of things that we can do for sleep. But there's one really powerful study that I wanted to share with you guys, and I'll link this in the post that we do after this, so you can go read this study. Melatonin is one of the many interventions that we have to help with sleep onset. And in this study, they used 4 milligrams of melatonin per night over 6 months, and people's migraines reduced by 2/3. So from an average, right, of 16 over that time to 5. That's a big deal. And then their headache intensity reduced from 57 to 37. This is really important, right? Because this is an over-the-counter, gentle intervention. And what this is really telling us is, when you improve sleep, you improve migraine. So you can imagine, if your problem isn't melatonin and it's something else, and we improve your sleep, you're likely to get similar results. So that's just one quick example of the things that you can do at home, right, to improve your migraines. There's so much evidence for both herbs and nutrients in migraine. And so I'm going to share some of that with you guys too. Our best researched herb for migraine prevention is something called petasites. And petasites is also known as butterbur. Have you heard of it, Dr. Yes.
Yes. And this is, I love it that you're going to get in here, because this is all stuff that even us on the allopathic side, this is all things that are approved by the American Academy of Neurology. So I'm very familiar with it. Except just don't have the expertise in how you navigate that. Yes.
Very good evidence rating for it, guys. I recommend that you get a pharmaceutical grade supplement. So talk to someone like Dr. Christian or I before you just go buy it, because supplements are not regulated by the FDA in the United States, which means you need to pick a pharmaceutical grade one that has good quality control to make sure there's no contaminants and to make sure you're actually getting what you need. And here's why. So there's an amazing study that I'll link in later, in petasites reducing migraine at a dose of 75 milligrams a day, twice a day. Migraine attack frequency was reduced by 48%, right? But what I want you to notice here is they also studied petasites use at 50 milligrams a day, twice a day. So instead of 150 milligrams, they did 100 milligrams. And in that group, the migraine frequency was only reduced 36%. So dose matters. And this
Yes.
is why I want you guys to talk to a professional, because it's your right, again, to use herbal medicine. But herbal medicines can interact with pharmaceutical medications. You need an expert to guide you through, and then dose matters. And this is part of why, and when you guys go through some of these articles that I post, I want you to read them with a critical eye. What often happens in complementary, alternative, and natural research is that we don't use a high enough dose of the intervention.
Mhm.
And then we start to think, well, maybe it doesn't work. But if you use the appropriate dose for you, which a trained clinician can help you figure out, you can get some major benefits. So, Dr. Christian, what have you seen with Butterbur in your practice?
Yeah, so in fact, that's where most of my patients will even start. Some patients are coming. There's people who have severe chronic migraine where they've had migraine for years. In patients who are coming in with the new diagnosis of migraine, this is where we'll start with Butterbur, some of the things you're about to talk about, and normally it's able to bring headache frequency and intensity down. And the other thing that you said in that research that's also significant is that when we actually look at the medicines that we have already approved for migraines, they don't work that well. It will work in about half of the people. Sometimes we take up to, and then the other thing that maybe you may talk a little bit about is like duration of, how long do people have to take this before they start seeing effect? Because sometimes people take it right away and they stop. Because the other medicine that we have, especially for preventing migraines, the antihypertensive, it takes about 4 months for this to work. And then we also know that by a year, 80% of people get off it because they're not able to tolerate. So this is an option that is much easier in terms of side effect profile. Overall, it looks like it works well. But the things that we're talking about here is not just one thing, not one pill, not one supplement. It's all about making you healthy, taking care of the mind, taking care of sleep. And all of that comes together to really kind of help this thing to be more effective. So in my practice, I've seen this to work well when people are combining all the right other healthy things that we are talking about here. Yes.
I love
How about
it.
your experience with this?
Absolutely. Within about 2 months, people see, I've seen complete resolution of migraines.
Oh, that's wonderful.
For up to a year. And this tends to work when I use it with B vitamins, which I think you would agree. Yes. So let me talk a little bit about that. So there are a couple B vitamins that are implicated in migraine pathogenesis. And we don't know if it's because people with migraine tend to be lower in these B vitamins to begin with. Right.
Yeah.
Probably, right? But the B vitamins in particular that we've studied very well are B6, B9 or folate, and B12. And we've seen that when we supplement these, particularly, especially B6, about 80 milligrams a day, we can see that headache attack frequency is significantly reduced. And when we combine them, the reduction is even more powerful. So if you're sitting at home thinking like, I probably get enough of these B vitamins, you'd be wrong. So
absolutely. Yes.
So we run a nutrient analysis on every single person who comes in our practice. And I'm going to share my screen really quick so you guys can see a typical one. But a typical migraine sufferer's diet looks something like this. And you'll see my little like.
Oh, I'm excited to see this because I think this is so important.
Can you see this?
Yep, we can see that. You can see that. Yes.
Absolutely. Yeah. So there's a couple key things here. And again, this is someone who is trying to eat well for their migraines. You can see here that many of the B vitamins, they have an inadequate intake, right? So B6, which I just mentioned, they're only getting 63% of what they need in a day just to be healthy, right? Mm-hmm. So, and then folate, same thing, about 2/3. And so simply by correcting these deficiencies in the diet, we often see people just kind of gracefully, easily, without side effects, move into a place in their life where they experience less frequent migraines.
Yeah, Dr. Henry, so was this patient thinking that they were doing all the right things in terms of nutrition, or they didn't know what they were eating? Or how did they,
Both, right? So people often come in and they're doing Whole30, but they feel confused because usually by the time people come see me, they've spent a lot of time online. They're usually like either afraid of fruit or lectins or gluten, which is great. That means they've read things, right? But our goal is really to do a data-based approach to nutrition, which is, are you getting these essential 80 nutrients every single day so that you can have optimal health? That's where we start. We don't start with good foods, bad foods. In fact, there's no such thing, right? It's, do you eat nutrient-dense foods that give you what you need to run your biochemistry? This person was not. We her case study is actually published, and so I'll link this. But we put her on a nutrient dense diet that met 100% of her goals for all of these nutrients. And we also put her on pedicides and extra B vitamins. Within a month, her migraines resolved, and it's been over 6 months and she has not had a migraine since.
Oh, that's wonderful.
Right. And this person was getting like 2 migraines a week, she was saying. That's a lot. That's a pretty high end of migraines. So the other thing I want you guys to notice is that this mineral intake is fairly low, and this is typical for someone who's eating a standard American diet. The number one deficiency in the US is vitamin B6, as reported by the CDC, and it affects 11% of the population, right? So we can expect that 11% of the population, if you have this deficiency, you're going to be at increased risk for migraines. We already know this. So simply,
Dr. Henry, why is that? Is that a function of the food being depleted, or why so many people don't have B6?
Yeah, so top sources, actually, I can show you this. Top sources of B6 in the US diet, the number one is garbanzo beans. Okay. Which, if you love hummus, you're good to go. Right, chickpeas. But the second one is beef liver. And then after that is tuna, and after that is salmon. And what you'll see is even if you eat a full serving of these every single day, you're not getting 100%. So you'd have to eat chickpeas and beef liver every single day, which, like, hey, if you're willing to do it, great.
Yes.
Additionally, this is why the USPSTF recommends that everyone be on a multivitamin, particularly women of reproductive age, because it's very hard to get this vitamin through food unless, again, you're eating beef liver a lot. And so that's why. Does that make sense?
You.
Yeah.
Yes, absolutely.
Yeah.
Yes.
So there's a couple other interventions that have been studied for migraine. One of them is zinc. And so I want you guys to see, again, this person was not getting enough zinc. And this is very, very common for someone who's eating a standard American diet, because the top sources of zinc, which I will show you, this is from that same website, ODS, are oysters, beef chuck, and crab. And I don't know how many of you have eaten oysters like every single day recently, or at least once a week recently, but not many. So again, this is why so many people say, oh, I take zinc when I'm sick and it helps. It's because most people are normally not consuming enough zinc. And so their immune system is not performing as optimally as it could be. Same thing with migraines. If you're zinc deficient, we know that you're going to have more migraines. And then there's also some really cool evidence that supplementing zinc gluconate 15 milligrams a day for 12 weeks reduces the frequency of migraine attacks and the severity of migraine attacks. This is like pretty powerful. The benefit is that it will also improve your overall health and reduce things like your cholesterol and your CRP, reduce your overall inflammation. So the bottom line is, for pretty much any nutrient we talk about, we could pick one, right? So we could pick vitamin D, vitamin E, vitamin K, and go on PubMed and find a study that says supplementing it helps with migraines. Like, just if you guys want the hack, and that's because you need all of these to be healthy. When you're not healthy, and if you're someone who has migraines, you're more vulnerable to more frequent attacks. So this is why we kind of start with a very comprehensive approach of let's just get you everything, right?
And I see CoQ10 here. That's something that I've also used. Can you talk about that? Yes.
Absolutely. So CoQ10 is a really cool nutrient. It helps with energy production inside the cell, which is deficits in energy production and mitochondrial function are linked with migraines. For those of you at home who are listening in. In this really cool study, they supplemented 100 milligrams per day, and the number of attacks per month dropped from 1.6 to 0.5, which basically means you go from having 2 migraines a month to 1 migraine every 2 months, which might not sound like a lot unless you are someone with migraines.
Yeah.
Right. So 12 a year to 6 a year or 24 a year to 6 a year is pretty profound. And this is just from a supplement. And the beautiful thing about CoQ10 is it has no side effects. And CoQ10 is difficult to get in the diet. So yeah. So does this make sense?
Yes, absolutely. And this is, all this resonate, because these are all things that I have also used in my practice, but I haven't done the nutritional analysis, which is actually quite fascinating to be able to see that and show individuals, because I think part of this work that we're doing And from my standpoint, I've come to this realization that just getting patients to connect the dots, right? We all know what we're supposed to do, we just don't do them. So if you can show an individual, look at this. And now by changing habits, you can see that the result or the alternative that helps with, getting us to do the things that we're supposed to do. So I think this is really very important to really show people how all of this look. Yeah.
And guys, you can do this at home. So the software that I showed you with that printout is, we use a professional nutrition software called Chronometer, but you can get a free version of it on your phone or on your computer. And it's just Chronometer. And
then go ahead.
You can run a nutrition
ask,
on your own diet. Oh, sorry.
Yes, sorry about that.
So yeah, you can track a day. So what I encourage people to do is create a free account, track a day to a week on the computer, and then see. You can see this for yourself. This is not behind a paywall, right? Go look, am I getting enough B vitamins? Am I getting enough zinc? Where we come in my practice and where we really help people who are struggling is that we help you design a nutrition plan that gets you 100% of these nutrients using foods you love, that are easy to cook, that your kids and your partner will also eat, that fits into your lifestyle. Because that's where the hard part comes in. You might go, okay, I'm not getting enough zinc and I don't really want to eat oysters. So now do I have to take like 100 pills a day? And the answer is absolutely not, right? This is where it pays to see someone who can help you design this. And then you have this template for the rest of your life, and you know how to eat to manage your migraines, how to eat to prevent your migraines, as part of a very holistic plan that includes pharmaceuticals, devices, right? Everything.
Yeah, I love that. And that was the question I was going to ask you. How do people do this? So you kind of got to that and explain everything else. So that's wonderful.
It's great. And look, if you're someone who's like, I don't want to do this through food, I hate to cook, we got your back still. Like, we can do gummy multivitamins and supplements. And what you'll notice is, if you're someone who comes in and you're very nutrient deficient, usually you're also not feeling your best. And so you're not really up for like cooking for hours per week. When we get people healthy and they have less symptoms and they're sidelined less days of the month by migraines, then they can cook. But that's 6 months down the road. So we always tell people, we'll get you the nutrition first, however it looks. Maybe you're eating 5 gummies a day and that's fine. But eventually our goal is to teach you to get it through foods you love. And it's not hard, guys. Like, some of the nutrients I showed you, and magnesium is another one we didn't even get to touch on that's important for migraine. You can get that through pumpkin seeds, chia seeds, right? And you can add that to like a really delicious either smoothie bowl, oatmeal bowl, or trail mix. And you don't even realize you're getting medicine. You just think you're getting a tasty treat or breakfast. You can add them to muffins and brownies. Like, we've got your back when it comes to being creative about this and making it fun.
I love that. And that's so important in really getting patients the tools and the power. And it's this idea of knowing that you can do something about this. This is in your control. Sometimes, pain and migraine, some of these things become, you don't even know what to do. It's all about control. How can I control this, right? And sometimes it's hard to control what you don't understand. And understanding the triggers or understanding the noxious stimuli are so important. And some of the things that I talk about, which I know you also do, is really this idea of even sleep and hydration, water. I've had a patient that it was just fascinating. I got him off migraine medicines by getting him to drink enough water. He was feeling so much better, and that's it. So some of these things are much more powerful than even the medicines that we have.
Well, and guys, it makes sense. And we go over this with folks in my clinic. I show them the cardiovascular system, and I'm like, it is a fluid-filled, pressurized, closed loop system. If you don't have enough fluid in that system because you're not drinking enough, you can't perfuse your brain. Literally, that's it. You can't deliver enough blood to your brain, and your blood is what contains oxygen and nutrients, as Dr. Christian's hydrated.
Yes.
Right. So, but you need someone to kind of sometimes sit down and walk you through this, because we are not taught this in school. Dr. Christian and I had to go to medical school to learn this, right? It's not a right. And our goal is to change that for you and to really empower you guys with this information so that you can take your health back into your own hands. So, Dr. Christian, I am thrilled that you joined us today. Can you please tell people how to get in touch with you and take the next step with you?
Yeah, so if you have migraine and you want to come see us, you can give us a call at 484-806-1101. And we are in Wayne, Pennsylvania. Alternatively, you can visit us on our website, at www.ethermedicine, it's AETHER medicine.com. And we'll be happy to talk to you, provide education, because I think it is so important for people to get educated. There's so many misconceptions about health and pain out there. And our goal is to really educate people so they can make the right choices and take the actions that makes them healthy.
I love it. You guys will be in very good hands. I highly encourage you to call. If you want help with the nutrition aspect of this and creating a plan that you can do every single day to minimize and prevent migraines, you can also find us at Sanare Today. So it's just www.sanarettoday.com, or you can call us at 610-344-9600. Thanks again for being here, Dr. Christian, and we will see you soon.
Yeah, thank you so much. This was great. Thanks.